Good morning. My name is Katie. I'm going to be your nurse today. We're just going to do a head to toe assessment on you, see what's going on, see if I can note anything maybe before the doctor comes in here.
Okay.
Can you go ahead and verify your name and date of birth while I wash my hands?
Yeah, my name is Taylor Miller. My date of birth is 4/20/96.
Okay, perfect. So I'm going to start by getting your vitals.
Okay.
I'm going to go ahead and get this pulse ox on you real quick.
Okay.
And then we're going to go ahead and do a two-step blood pressure. So I'm not actually going to check your blood pressure on this first one, but I'm going to put this on here for you. Pump this up here. Pulse. Perfect. We're going to give your arm a little bit of a break here. I'm going to grab your temperature. Sorry. Great. We've got 98. I can go ahead and take that pulse ox from you. The pulse ox is also 98, so that's awesome. And then I'm going to go ahead and grab your pulse. Let me grab my timer here. Alrighty, Tyler, thank you. Perfect. So, your respirations were 12 and your heart rate was 66. And now I'm going to go ahead and take that blood pressure from you. Go ahead and clean the stethoscope off first. Alright, this will be really quick. Alright, Miss Taylor, it was about 110/68 today. A little bit on the low side.
Yeah, that's pretty normal.
Alright, does your primary care provider know about that?
Yeah.
Alright. Good to know. So can you tell me a little bit about your pain?
Yeah, I've just been having some really bad, stomach pain recently.
Okay, when did it start?
About 2 days ago.
2 days ago? Okay. And on a scale of 0 to 10, when, 0 to 10, 10 being the worst, what would you rate it?
Like a 7.
Like a 7? Okay. And on that
Maybe
same,
8 on some days.
okay, and on that same scale, what would a tolerable pain be?
Probably like a 2.
Okay. Alright, and you said it started a couple days ago?
Yeah.
Okay, is there anything that makes it better or worse?
There's not really anything that makes it worse, but sometimes like curling up in a ball in the fetal position helps it feel better.
Okay. And you said this was like lower abdomen pain?
Yeah, like right, like it's almost like where I would feel period cramps.
Okay. All right, well, we will go ahead and take a look at that. I'm going to continue your head to toe assessment. When we get to that area, I'll be super gentle. We'll be really careful, and then we'll make sure that we take an extra good look there and try to figure out what's going on. But I'm going to go ahead and start with the neuro assessment. Can you tell me where you're at?
I'm in the hospital.
Okay, can you go ahead and tell me the year?
It's 2022.
Perfect. And your speech is not slurred, so you are alert and oriented times 3. So I'm going to go ahead and take a look at your eyes. If you can just look at me real quick. Pupils are round and equal. I'm going to go ahead and shine this light in your eyes real quick. Perfect. You're also reactive to light. Go ahead and follow the tip of my pen for me. And then all the way in. Great. Perfect. And they pupils are also accommodated, so wonderful there. They track great. And then I'm gonna go ahead and do a sensation test. So this is going to feel dull, and this is gonna feel sharp. And I'm going to do this on different parts of your body. I'm gonna have you close your eyes, and then you can tell me what you feel and where.
Okay.
So go ahead and close your eyes for me.
Sharp on my right arm. Sharp on my left arm. Dull on my right leg. And dull on my left leg.
Perfect. Great. And then go ahead and grab my fingers for me. You squeeze. Great. And then go ahead and push on my hands like a gas pedal. Great. And then go ahead and pull up for me. Awesome. And then while I'm down here, I'm also going to check your heels. Great. Heels are not red. Wonderful. I'm going to check the cap refill. Toes look wonderful. Cap refill looks great. And then I'm also going to check your pulses while I'm down here. Great. People pulses are equal. Great. Pulses are equal bilaterally. Let me wash my hands real quick. Wonderful. Do you have any numbness or tingling in your hands, feet, anything like that?
No.
Okay. And your speech is clear. You don't have any slurring. So we're all good there. I'm going to go ahead and move on to the cardiovascular part of your assessment. So I'm going to listen to some different parts of your heart with both sides of my stethoscope. And then we will move on after that. So pulmonic, aortic, herbs, tricuspid, mitral. And I'm going to use the other side of my stethoscope and do the same thing. Pulmonic, aortic, herbs, tricuspid, mitral. Great. Noted S1 and S2 sounds. So that is wonderful. That's exactly what we want to hear. Can I go ahead and see your fingers? I'm going to check the capillary refill of your fingers. Great. Equal bilaterally. Perfect. Just what we want to see. Have you noticed any edema or swelling in your legs? Okay. Have you had any calf tenderness or leg tenderness? Okay. Does any of this hurt?
No.
Okay. Great. Love to hear that. I'm gonna go ahead and check, we're gonna move on to respiratory. So I'm gonna go ahead and check your precordium here, which is just up on your chest. Great, I don't see any lifts, heaves, or thrills, and there's no palpable masses or lumps.
Okay.
And I'm gonna go ahead and listen to your breath sounds. So go ahead and take some deep breaths for me. Alright, we're gonna get on the side here. Okay, can I have you go ahead and sit up for me? Great, Taylor, thank you. And have you had any coughs recently?
No.
Okay, great. So now we're gonna move on to the GI portion. So I'm gonna listen to your belly a little bit,
Okay.
listen to the sounds going on down there, and then I'm gonna poke around and just see if I can feel anything.
Okay.
But we'll be super gentle, and then let me know if you have any discomfort or you feel anything, you
Okay.
feel like anything's weird. Okay. You have normal active bowel sound, which is great. Poke around a little bit. Everything feeling okay?
Yeah.
Okay. Perfect. The belly is soft, round, and non-distended, so that's exactly what we want to see. That's great. Have you had any nausea or vomiting?
Sometimes when my pain's really bad, I get a little nauseous, but no vomiting.
No vomiting. Okay. And do you feel like you pass gas normally?
Yeah, pretty regularly.
Okay, great. And what's pretty regularly like?
Probably a couple times a day.
Okay. Okay. And what was your last bowel movement?
This morning.
Okay. Can you describe your stool to me?
Like, it was like light brown and like soft, but not like too soft.
Okay. Was there any blood in your stool? Not black or tarry or anything like that?
No.
Okay. And how often do you normally have bowel movements?
At least once a day.
Okay. Great. And then, how often do you urinate?
Like every few hours or so.
Okay. And can you describe the color of your urine to me?
It's like light yellow.
Light yellow. Is it cloudy? Clear?
Usually clear.
Clear. Does it have any odor to it?
Sometimes.
Sometimes. Okay. So the last part of our assessment is going to be the skin. So I'm just going to go ahead and check the temperature, the moisture of your skin, just stuff like that. Super easy. I'm going to go ahead and look here. There you go. Oh no. You're feeling pain at the moment?
Yeah, I'm getting a cramp. Hold on. Okay,
Oh no.
we can get
Doctor.
through this. We can get through this.
Help. Okay. Okay, so we're gonna note temperature. Great. Moisture and temperature, great. Equal on the arms. No redness. No abnormal moles. No cuts or anything. Same for the legs, temperature, moisture, normal, no redness, no cuts, no incisions, nothing that seems out of the ordinary. I checked the heels already, we didn't have anything going on here. Can I have you roll over for me? I'm just gonna go ahead and check your back real quick. back's nice and warm. Skin is dry and intact. Coccyx area is clear, not red. Perfect, you are good. Good there. Yep, the heels are not red, no sores. So you check out. Great, Taylor, you look awesome.
Thanks.
I'm really sorry that you're in so much pain. We're going to do everything that we can to get you better. I'm going to go ahead and wash my hands one more time, get everything charted for you, and then we'll get the doctor in here as soon as we can.
Okay.
And do you have any questions for me at the moment? Okay, sounds good. Well, I'm going to go ahead and leave this call light here in case you need anything. I'm going to go ahead and check on my other patients, and if you do need anything, don't hesitate to call me.
Okay.
And I'll be in here as soon as I can.
Okay.
All right.
Thank
Thanks,
you.
Taylor.
Good job!